We're here at Pure Plastic Surgery and it's Hump Day with Dr. Alex Earl. The first Hump Day of 2023. So welcome back everybody. I hope everyone had great holidays. Happy New Year. And I'm excited to be back, though I had a great time. Some of you saw I was off in Iceland, which is awesome. I highly recommend it. But I'm glad to be here. We've had a great week so far. It's already Wednesday, so surgery started back up on Monday. We've done quite a few cases. And everything's been awesome. So we did a few BBLs, breast cases, mommy makeovers. We're having a great time here in 2023. And today, for the first hump day of the year, I want to talk about something that's kind of been popping up lately. I've been seeing it in social media. I've been seeing it kind of in regular media as well. Patients are asking this question, and everyone is all of a sudden asking, is the BBL dead? Are we done with the BBL? And so, you know, some of the like the big names that kind of made the BBL popular, like Kim K, you know, they're showing a little bit kind of more, you know, slimmer bodies, you know, less like very large curves. So now it's where you see more like enhanced natural looks as you look into like, you know, IG influencers and models and things like that. So this question starts popping up. And so the short answer, we're going to get into it, but the short answer is no. It is not dead. But it is evolving, okay? But if you want to look at the hard numbers, okay, we just had the data come out from 2022 from the ASPS, the American Society of Plastic Surgeons, and what we've seen in 2022 is that the number of gluteal or buttock enhancement procedures, which are mostly BBL, some implants, grew. So it actually went up by about approximately 30%. So not only is it increasing, but it's increasing quite significantly. And this is compared to 2021, which grew, you know, another 30% from 2020, et cetera. So if you're looking at a graph in terms of the number of BBLs that are done in the US, it's still going like this. So we're still on the up and up. But what is happening, okay, is that the BBL is evolving. All right, it's evolving. Whereas before maybe it was a young surgery, a surgery that, you know, we're kind of still learning about. Right now it's evolving and it's maturing, and I think that's what's going on today. So how is it evolving? Well, I mean, if we take it back to basics, we know that, you know, quite a few years ago, let's say 10 years ago, when people first started doing the BBLs, we were actually purposely putting fat into and deep to the muscle. Okay, and why was that being done at that time? Because the muscle and deep to the muscle has the best blood supply, and therefore the fat, you know, most of that fat would survive. And also it created, you know, multiple compartments to put the fat. So you can put the fat beneath the muscle, into the muscle, and then above the muscle. So you have multiple compartments, so you can do these massive transfers. So back then it wasn't unusual to put in 2,000 cc's, maybe even more during that time. So you can get these big drastic vixen looks with just one round. But as many of you know, it's dangerous to do that, right? So the mortality rate was super high 10 years ago, approximately 1 in 3,000, which was way too high, much, you know, and the highest of all aesthetic procedures at the time. And sometimes you'll still hear that number being thrown out, but that number is now completely outdated, okay? So if you see an article and they tell you that the BBL is the procedure with the highest mortality of all cosmetic procedures, that is not current data. Okay, that reporter or whoever looked at the data has looked at data that is old. It's not the current data. Okay, so in 2017 or before, the mortality rate was about 1 in 3,000. All right, by 2019, because of all the changes that we did and we started focusing on placing the fat between the skin and the muscle in that safe space, the mortality rate was now 1 in about 15,000. Okay, which is equal or even better to a tummy tuck. And today, 2022, that is even lower, probably to one about 25,000. Okay, and if you're going to a place that uses ultrasound, okay, where you make sure that that fat is in that safe space. There's been reports as it's as low as 1 in 50,000. So, okay, so when you see those headlines, deadliest procedure, that is just they're trying to grab headlines. It's outdated, but of course you have to go to the right person, right? You just can't go to anyone. You can't go to someone that's putting it in the muscle. They're putting in the muscle, you're back to this. Okay? You go to someone that uses the ultrasound and make sure that you're putting it between the skin, between the skin and the muscle in that safe space, which is what we do here at Pure Plastic Surgery, then you're much closer to this. Okay? All right. So BBL is not dead, but it is evolving. And a few years ago, the looks that they were going for were very, very, like extreme looks. It was, those extreme kind of vixen looks where you try to get the waist as small as possible, and you're putting in large and large amounts of fat to make the hips and the buttock as large as possible. Lats were in, so you had a lot of these kind of, where the waist came in, but then you had the kind of a high look like this. Okay, it was like a high look, so lats were in, and if you're going from the side, shelves were in. Kind of the booty would come out with a shelf like that from the side. And so these were very, very surgical looks, meaning that you could tell right away if someone had a BBL. And so what's been going on now is as the BBL evolves, now we're not looking so much into those high lats. We're looking to add a little bit more, less lats and hips for sure. Those kind of like more kind of hourglass from the front, upside down heart from the back. So the shape, if you're coming in like that, it's kind of more from the back. It's more like this, like that kind of that upside down heart look from the back, right? Okay. And then in terms of the side, you had, right? You started shelf was like where it kind of really comes out like this, and then you have a slope where it kind of comes out more, and then the slopey way and a more natural look there, and then of course you have some stuff in between like a pokey slope or a slopey shelf there. And so today you're not really seeing this much. You're closer to a slope, or sometimes if you want a little poke, you can have a pokey slope there. Okay. So now the enhanced natural look is what most patients are going for. And I'm happy to say that we've been doing that here at Pure for actually, I think we're ahead of the curve. That was kind of my signature style for a long time. And those of you that have been following me for a while, you know that I really love that upside down heart shape look. And I've been doing that for a long, long time. And if you look into what we call the South Beach butt lift, or BBL, which are our signature fat transfer to the buttock that we do here, that we have kind of very beautiful, smooth curves, smooth transitions, and that we tailor the procedure to that patient's very own specific and unique foundation. And that's really what it's all about now. So now, the BBL, from simply being a basically suck fat and inject fat procedure, like in any which way that we do, now it's a lot more, like I said, a lot more involved, there's a lot more detail to it, okay? Because now we gotta tailor the procedure specifically to that patient, their foundation. So you got to put together what the patient wants along with their foundation and create a beautiful result that's going to be nice and smooth with smooth transitions, and it's going to last for a long, long time. And I think that's the other key here now, where I think BBLs from before, what we're seeing today is that a lot of patients are coming back for what they're calling a BBL reversal, okay? BBL reversal. Okay, so what does the BBL reversal mean? Well, it's not just about decreasing volume. It's also about reshaping. And actually, most of the cases that we see here are more about the reshaping than necessarily, removing volume from the hips and the buttock area. And this is a trend that we've definitely seen going up. We're seeing that go up for sure. So a lot of people inquiring about BBL reversal, redoing their shapes. So those that had, shelves, they want that to be a little bit more of a slope. Those that have the high lats and kind of like that wisdom tooth look, they want to change that to a more upside down heart. And for many, many of our patients, we're able to do that. Of course, now these can be challenging cases. And so I do take that on a case-by-case basis. Not everyone's going to be a candidate. I really have to make sure that I feel that I can help the patient, right? I don't want to do something and then the patient looks, very, very similar with not much of a change. That's not going to help anybody. And I definitely You wouldn't want to do that to a patient. So I'm going to take those cases, I'm going to look at your photos, I'm going to look at what was done before, and if I feel like it can definitely change, I can reduce some of the volume, I can change the shape, then you'll be a good candidate for that procedure. Now here's a caveat that you guys, that all of you need to know. If in your original BBL from several years ago, say before 2017, they put fat into or beneath the muscle, we're not going to be able to remove that fat, okay? We cannot liposuction the muscle or deep to the muscle. That is, again, it's going to be dangerous, right? Those vessels are still there. So that big superior and inferior gluteal vessels, those big veins that are there, we can't risk injuring those vessels. So if the fat was placed into or deep to the muscle from a prior BBL, that fat's just going to have to live there forever. There's nothing that we can do to reduce that. Now, if the fat was placed in the safe space between the muscle and the skin, and you want to reduce some of that either in the buttock area itself or the hips, then yes, then that fat, similarly to liposuction everywhere else, we can reduce that fat, right? So liposuction, say in the belly or the back, that's the fat we're targeting. It's a subcutaneous fat, which is the fat between, say, the abdominal wall muscle and the skin, or the back muscles and the skin. That's a superficial subcutaneous fat that we can reduce. And so that's the same fat in the buttock and hip area that we would be able to reduce at that time. Okay? All right, so I hope this clears it up. So, like we said, BBL dead? Absolutely not. That the surgery actually is still growing. More and more people are seeking buttock or gluteal enhancement. Most of it through fat transfer, but it is evolving. The shapes are being different. And of course, a lot of this is influenced by social media, right? So, before you had like the big vixen look and that was in, and now as you see all the influencers and the artists and all this, they're showing a little bit more athletic shapes, more what I like to call an enhanced natural shape, a shape where it really fits their frame and their body, and that it's not so obvious. Like before, now people don't want everyone to know, for example, that they had surgery done. So we're hiding the incisions, we're making less incisions, we're creating smooth contours, so that even if you go out on a small bikini in South Beach, nobody can really tell for sure. Did she have surgery? Did she not? We don't know. And so that's what we're going for nowadays. Okay? And I'll be happy to take any questions.
A lot of questions.
All right, let's do it. Everyone's been waiting since 2022.
Okay. Can one get fibrosis from a tummy tuck?
So typically not from a tummy tuck. So fibrosis, we see that more with the liposuction. We do a little bit of liposuction with the tummy tuck to the flanks and the waist. So is it possible to get some there? It is possible, but we don't see it as often. So usually no, not with the tummy tuck. We see it a lot more often with Lipo 360 or BBL.
Okay. Next one. Sorry.
Sure.
Okay. Can your hip dips skin be too tight for fat transfer?
Right, so that's a great question. So the skin has what we call elasticity, right? So the ability to expand. But there's, the skin, not everyone has the same skin. Some people have the type of skin that can expand quite easily, and some people have fairly tight skin. So the tighter the skin, the tougher to expand, and you may then need more than one round to achieve the look that you want. Unfortunately, what happens is that a lot of times the skin in that hip area tends to be a little bit tight, and so therefore it won't expand as much. But what I would like to say is that really the only way to quote unquote fix a hip dip is with fat transfer, okay? That area, it's technically called the trochanteric depression. And in that area, there's no muscle, right? There's no muscle there to build. It's impossible to fill in a hip dip by going to the gym, all right? What's there is just basically tendons. And so what you need is you need to fill in that space, and the best way to do that is with your own fat. So if you have hip dips, the best solution for you is going to be fat transfer or BBL. And then in terms of how far can we expand and what's the final look that you're going for, well, that's what's going to determine how many rounds you need. Is it possible you may need more than one round? It certainly is. You may need 2, potentially even 3 rounds to get to, your desired goal.
Okay, do you have to wear a faja for the rest of your life post-lipo?
No, not for the rest of your life, though I'm sure some patients can kind of feel that it seems that way. But you definitely, for most patients, you have to wear it for at least 3 to 4 months, okay? So in the first 6 weeks, you're gonna be using that faja pretty much night and day, at least 23 hours a day. And then after that, you're gonna scale down to 12 hours a day, but you are gonna use the faja starting at, at the post-op, after 6 weeks, you're gonna start using the faja 12 hours a day. You're gonna do that until you get to about the third or fourth month after surgery. And then you'll see how you do. There are some patients that like to wear it a little bit longer, and I've had patients that wear it for, say, maybe 6 months or even up to a year, but typically then they stop after that.
Hi, Doc. Do you do armpit operations to do breast augmentation? Is it safe?
So I don't do a breast augmentation through the armpit. There are a few surgeons, actually I would say probably not many, there's a few surgeons that do that. In my experience, I feel that first of all, you don't have direct vision, so you can potentially run into issues such as bleeding and things like that. Also, when you do that, it's very, very tough to, if you're going to go beneath the muscle, it's very, very tough to release the muscle underneath there and create what we do call a dual plane. So the chances that the implants end up a little bit too high and then you have what we call an animation deformity are also higher. And then, it's much easier to do that procedure when you're using saline implants, but nowadays we don't use saline implants that much anymore. We're using our 5th generation silicone or gummy bear type implants, which have the best natural look and feel and are the longest lasting, and they are the ones that I recommend. So in general, I recommend doing a breast augmentation through what we call the inframammary fold incision. Okay, it's still a small incision, only it can be done in about 3 to 4 centimeters. So a very small incision there. It's done under direct vision. We know exactly where the implant is going. If we need to divide the muscle, we can, to decreasing the risk of animation deformity. And it has the lowest incidence of infection and the lowest incidence of capsular contracture.
Are drains required after BBL, or do you do drainless BBLs?
So for the BBL, it's not an absolute requirement. I do tend to use drains. I like it. I think it's easier for the patients overall. I think it also helps the massage therapist, and they can just massage towards the drain, and then the fluid can come out through the drain without having to reopen incisions and do things like that. So I do like using drains, and for most patients I do use them. But if there are patients that absolutely don't want them for whatever reason, then for a BBL that's okay. We don't have to use them. We can just leave the incisions open, and then they can have their massages and drain through there. Now that's different than, say, a tummy tuck. For a tummy tuck, I use drains, and those are mandatory.
How long do you have to wait to go back to work out after lipo and BBL?
So you should wait at least 6 weeks. All right, so 6 weeks for any heavier lifting, training activity, going back to the gym and things like that. Before the 6 weeks, walking is okay, and you can walk at a normal pace as far as you want. There's no limit to how much you can walk. But if you're gonna do anything more strenuous, like running, jumping, jogging, gym, and even sexual activity, all right? So that's a key. That's a question that we get often as well. So you want to limit sexual activity till after 6 weeks as well.
Can I still book a surgery even though I'm still losing weight and my BMI is over 30?
So if you're close, right? Say you're losing weight, you're doing well, your BMI say is 32. And you know that my max BMI is 30. So for me, the BMI needs to be less than or equal to 30. Okay. But say if you're 32 and you're losing the weight, then at that point in time we can start evaluating you, and we can start thinking about a surgery date. With a caveat that by the time you get to surgery, it needs to be 30 or below. Okay. If you do get to surgery and it's above 30, then we may have to either cancel or postpone your surgery. Okay. So that's why we want to wait till it's fairly close, right? If your BMI is 36. You got quite a ways to go, and I know you can do it. I'm certain that you can, but it's too early really to do an evaluation and set a surgery date. All right, but if you're fairly close to there, then we can start the process.
Okay, if I'm traveling from the UK, how long will I have to stay in the USA?
Great question. Here's a few things that you need to know. So for those of you that are coming from other countries, and the only exception here is Canada, those of you coming from other countries, even though we're going to ask for labs being done in your own country, we're also going to need labs to be done here in the U.S. Okay, so it's just part of the Florida Department of Health, some of the requirements that we need in order to properly evaluate you and then do perform surgery under general anesthesia. So I know that's a little bit annoying, but we do need basically two sets of lab. One in your own country so we can take a look at the labs, make sure that everything looks okay and that there's nothing that we need to work on. And then you're probably going to come here about a week before surgery so you can get your labs done here and we can get those results in before the day of your surgery. Alright, so you're going to be here about a week before surgery, then you have surgery day, and then you have to stay at least a week after. Alright, so for most of our patients coming from the UK, Europe, and we've had patients come all the way out from Australia, and of course Central South America, most of those patients end up staying about 2 weeks.
Okay, there's a reason why you don't do a BBL and a tummy tuck at the same time?
Yeah, so there's actually a few reasons. One of the reasons that we have is that the Florida Department of Health declares that when you're doing a tummy tuck, you can only remove 1,000 cc's of fat via liposuction. So 1,000 cc's tends to be fairly limited. That's what most patients have in their flank and their waist, which is why we combine that with the tummy tuck. But it's really not a lot of fat removal, and therefore not a lot of fat that we can place into the buttock area. We'd have to divide that in half and only 500 cc's per side, which is not going to make a huge difference, okay? So you're not going to get the best bang for your buck there. You're going to get a suboptimal result for your BBL because we can only remove those 1,000 cc's. The next thing though is also your recovery, right? So for a tummy tuck, you have to be not only on your back, but you have to be on your back and you have to be kind of inclined up. Okay, but for your BBL, you should be on your belly, right? To get the best result there, to get as much fat to survive. So what ends up happening is that you end up getting kind of a recliner where you then do like a cutout underneath there. And so even though the buttock may hang lower in the cutout, the hips are getting compressed in that cutout. And so you end up losing quite a bit of fat, especially in the hip area. So the recovery is very, very tough. It's really not optimal. And at the end of the day, what's going to happen is that you're going to get a suboptimal tummy tuck, you're going to get a suboptimal BBL, and you're just not going to be happy. You're going to be coming back for a second surgery anyways, okay? So if you really want the best, longest lasting results, it's best to separate out those two procedures. And if you're going to do both, you should do your tummy tuck first. All right, remember guys, this is something that I've been saying for a long, long time. You want to have the best results, do your tummy tuck first, then come back 3 to 4 months later to do your BBL.
Okay. Can you do arm and face lipo with a mommy makeover?
So yeah, a lot of times we can combine that. By face, I think more specifically you mean the chin lipo. And the arm, sometimes we can add that as well. So, as long as we're not like going overboard too much in terms of how much fat we can remove, once again, we're only able to remove 1,000 cc's. A lot of patients, that's what they have in their flanks and their waist. But fortunately, the arms tend to not, add that much more fat. The chin certainly doesn't add almost any more fat. So a lot of times we can, add, say, a chin lipo or a face tight chin to a mommy makeover, or arm lipo to a mommy makeover as well.
What brand do you most often use for breast implants?
So yeah, I use the Natrel. That's the brand that we use here. It's some of the sample implants that we have here holding up our board. So these are the Natrel implants. They're 5th generation silicone implants, typically known as gummy bear implants. I only use smooth implants. That means that the shell of the implant is smooth. I don't use textured implants. And most of those issues that you heard about, like the lymphoma, and so the ALCL, breast implant associated ALCL lymphoma, and things like that are all associated with textured implants. So I would stay away from those. I would just do smooth, round silicone, 5th generation silicone implants.
Doc, can you do a tummy tuck and add etching at the same surgery?
Yeah, so a lot of times you can do a little ab etching with the tummy tuck for many patients. Of course, you have to be the right candidate, but for the right candidate, yes, as we remove the excess skin, we can then do a little bit of lipo here centrally, a little bit of lipo along the sides there, and create that more kind of athletic, etched out look.
Okay, why do you recommend the cell saver for lipo, or is it not needed?
I do highly recommend it actually. So we use the cell saver for all our lipo 360 and BBL cases, which include lipo 360. Okay, and the reason for that is so that there's basically less blood loss overall for the surgery. So what does the cell saver do? So when you do liposuction, right, you're removing fluid, you're removing fat, and with that fluid comes obviously some blood, right? And so then we separate the fat from the fluid, and we run the fluid through the cell saver. And what the cell saver does, it has multiple filters that separate the blood from everything else. And then that blood, we can give it back to you. You can think of it like an auto transfusion. So instead of losing, say, 2x amount of blood, we're able to give some of that blood back for you, and then you only lose, say, X amount of blood. It's never going to be 0. We can't give it all back, but we give a lot of it back, which means it's overall less blood loss for the case. Means that you're recovering quicker, you're feeling better sooner, you're recovering faster, and there's also less of a chance of needing a blood transfusion. It's not 0. I mean, I've had patients who've had surgery, had cell saver, and then needed a blood transfusion. It's rare, but it can happen. So it's not 0, but it definitely greatly decreases the chances of needing one.
Okay, Doug, another one from here.
All right.
This is from TikTok. I got
Okay.
Lipo 360 BBL with the J plasma done 3 weeks ago.
Okay.
I have lumps under my armpit. Is it normal? This is from another doctor, of course.
Yes. So it's a little bit hard for me to tell, exactly what's going on without having been there and being able to evaluate you. But sometimes, due to the inflammatory process, some of the lymph nodes, especially underneath the armpits, if that's the area that you're looking at, sometimes those can get swollen, and you can feel some lumpy, bumpy areas, because of that. So what would be my recommendation? I mean, I wouldn't freak out for sure. It's quite possible that that's all it is. But definitely reach out to your surgeon and let them know what's going on, and ask them, if they have any other recommendations.
Is it possible to have chin lipo just alone?
Sure, yeah, we can certainly do that, and if that's all we're doing, a lot of times we can do that under what we call twilight anesthesia. So that's where we are giving you a little something in the IV to kind of make you sleepy and groggy and stuff like that, but it's not the full-on general anesthesia where we have to put the tube in to help you breathe and all that. So that's my preferred method. If we're just doing chin lipo alone, then we'll use the twilight type anesthesia.
Can we get a BBL while coming off of weight loss medication?
You can, but you want to make sure you're off the medication, that the medication is no longer in your system, okay, and that your weight is stable, right? You want to make sure that you have a stable weight. So it's not going to help to be on this medication, get off for 30 days, have surgery, and then all of a sudden your weight goes all the way back up and you gain 20 or 30 pounds or whatnot. That's greatly going to change your results, and it's not going to be a long-lasting result. Some of the common weight loss medications you cannot have in your system at all before surgery because they can interact with anesthesia and they can cause issues with the heart, and most severely like a heart attack. So you have to be very, very careful with that. All right, so one of them is called phentermine. You got to make sure that you're off phentermine for at least 30 days before surgery, and that we do test for that for the day before surgery. We do a urine drug test basically. And if you are positive for phentermine or amphetamines or anything like that, then your surgery will get canceled.
How about the diabetics? Can you have a BBL if you are a diabetic?
You certainly can, as long as your diabetes is controlled, okay? Whether it's type 1 or type 2 diabetes, you want to make sure that you're on your medication, you want to make sure your blood sugars are controlled, and we are going to do an additional test. It's called the hemoglobin. So hemoglobin A1C. All right, hemoglobin A1C, and it needs to be less than or equal to 6.5. Okay, So that tells us that your sugars are well controlled and that we're okay to move ahead. Now it's higher, significantly higher than that, then it's best to optimize your sugar levels. You got to talk to your either your endocrinologist or your primary care provider to adjust your medications to make sure that your sugar levels are more stable.
Last but not least,
yes.
How can we book a consultation?
Oh, yes. All right. So booking a consultation for 2023, it's actually, I'm going to tell you the easiest, most straightforward way to do that, okay? So the easiest, most straightforward way to do that is to go to our website. So you're going to go to www.pureplasticsurgery.com, okay? www.pureplasticsurgery.com, and right there on the very first page, on the home page or the landing page, if you will, you're going to see there's going to be like a little button tied towards, towards the top of the page or somewhere there. It's going to say virtual consult. Okay, so you're going to hit the button, it says virtual consultation, and from there it's going to take you to an area where you're going to fill out a questionnaire. You got to make sure that you fill out every single line on that questionnaire. Okay, fill all the lines. You are going to get to a line that says procedure, and it's only going to let you choose one, and that's okay. Don't worry about it. Say for example that you're interested in more than one procedure. That's okay. You don't have to put everything there at that point. Just fill out one of them. Let's get all your information in. It's going to ask you for some photos. You're going to send at least 3 photos. And once you send all that in, it's going to come to our patient care coordinators, and then they're going to reach out to you. And then you're going to be able to talk to them and explain everything that you're thinking about. And, if you had more than one procedure, that's fine. They're going to talk to you about that as well. All right. But that's that's the best way to get started. Now, do we only do virtual consultations? No, we don't. But this is the best way to get started so you can get all your information to us, and then our patient care coordinator will reach out to you. And then if you want to do, say, a video consult, then they can organize that for you. Or if you want to do an in-person consult here in the office, they can arrange that for you as well. Okay? So just because you're filling out this form doesn't mean that that's the only way that we do things, but it's the best way to get started because that gives us all the information that we need. And therefore, when the patient coordinator calls you, she'll have already a lot of information there, and it's going to be a lot more efficient for when then she tries to arrange any further consults or wants to, provide a quote or anything like that. Okay? So make sure you go do that. Virtual consultation, best way to get started. And after that, our patient care coordinators will take care of everything else. Okay? All right, everybody. Well, I hope you enjoyed that. So you'll be seeing that popping out a lot now in the news and in social media. Is the BBL dead? The short answer is absolutely not, but it's evolving. And it can be very, very safe if you're in the right hands, okay? In our hands here at Pure Plastic Surgery, we've never had any fat embolism from a BBL because we use ultrasound technology, imaging technology to make sure that we're placing that fat in the safe space, okay? All right, well, I look forward to seeing everyone next week on Hump Day with Dr. Alex Earl. All right, I'll see you then. Ciao.